Huh? What? No mask? Cheersing? God. It's like a whole other cheersing. I don't know how do you say
What
it.
is it
I'm not
called?
really a drinker.
Toasting, I think.
What is it? Toasting.
Toasting.
Oh, sorry.
Toasting. Okay.
Cheersing.
Cheersing. Wow.
Hey, obviously I don't get out much. I don't even get up much either. 6:39. Let's bring it from the KUAM News Zoom room. Dr. Peter Lombard. Good morning, Doc.
Morning. How you guys doing?
We're doing all right.
Nice kitchen. I love those tiles.
I can't see.
You can't see.
I
Bree doesn't
can
have her
see.
glasses. He's got that kind of 70s ish. That's really cool. Doc, how are you doing? First of all, it's been more than a minute. Let's just catch up on you personally.
Well, I got to say, I'm feeling pretty grateful myself. Fortunate to hear the state surgeons say, even though we're in PCOR 1, that regular medical care will go on, and so I'm in a better shape than a lot of other business people out there, where I can still bring my employees into work, and we can still take care of patients, and for that, we're all super grateful. Our health has been good, family's good. So besides that, just the calamity around us is the only thing that really is causing anxiety in our household here.
Calamity. What a word to describe what's happening on island. What do you make of all the numbers that we've been seeing in terms of positive cases?
Well, I think it's been kind of nice to have had such a long time with very low numbers, and towards the end of last month, you could see them start to creep up. And if you look at the sit rep, by the way, shows a lot of meaningful data. I think I'm still trying to track the numbers as best I can, but if you look towards the bottom of that, and they're showing that the 7-day average of daily new cases and the 7-day average of test positivity, those two graphs alone are fantastic. And I think if that's the only thing you follow from there, that's probably one of the most important things I'd still like to see on there, though, would be how they put finding out the ages of the most recent cases is not easy. You can do it, but you have to be super meticulous. And actually, I haven't been tracking that, but I think there are people out there that are. With the GIC releases, they'll even on the sit rep, they'll show you the breakdown of the ages for all the cases. And if you plot that out every single day on the spreadsheet, you'll be able to see which ones are changing. But it's extremely valuable information to know if, out of our last 100 cases, how many of those were over 50, over 60, over 70. And it's just really not easy to get that information very quickly, especially if you're trying to figure out how worried should we be, how soon may we expect to see our next fatality, for example. Certainly we're all concerned about the numbers going up. There's, a couple temporizing factors here. There's a couple, others that we're going to say we have to stay vigilant if we want to enjoy what we have up to this point. The reality is where we are now is I think others have said it. This is what we're in for a while. We haven't, by virtue of where we are, by virtue of maybe some luck factors, we have not had a massive amount of disease in the community. The places in the world that have, fortunately for them, things are tapering off, and we're not seeing the same kind of rebounds in those areas, in those countries, in those cities that were really hard hit. Is that because they are being more strict with their mitigation protocols? Probably not. Probably does have to do with the fact that they were hit very quickly. It doesn't mean you want to. And I think the cities of the world are sort of in the counties, and they're in a position to say, where are we now? How close are we to the vaccine? And how much death and destruction have we seen to this point? Is it worth it to continue down this course to save as many lives as possible? And I think in a place like Guam, that's the course we have to be committed to. But these levels that we're seeing lately, we went up from about maybe 2 to 4 cases per day on average, to 5 to 8 to 10, and now we're up to about 15 cases per day on average if you average the last 7 days. And I think that daily average is important because if you looked at the footnotes on the sit rep yesterday, those Navy cases that were reported in 2 sort of big batches, those cases actually came in over the course of about a week or maybe even longer. So you really got to sort of average those out over the days. And so we're sitting on about 15. And I had thought actually that about 100 cases a week was about what we could tolerate without overwhelming our system here. And we're right about there. So I think that if we just maintain 15, I think we won't overwhelm GMH. And I'll say that with some caveats that I don't know exactly what the how things look over there, but that also means we're still at a level where we should have had another fatality already. If you just look at the statistics, we had 5 deaths in our first 130 or so cases, and we're about 4 times that now. So the fact that we've had 0 deaths since there is pretty remarkable, but also speaks to the types of patients that we've been, the types of cases that we're getting, mostly in lower age group populations where the infection fatality rate is so much lower. A couple of really great studies have come out lately. There's this meta-analysis where they just take a look at all the data and they say, where's our infection fatality rate now for COVID? And I think what they're saying is globally, overall, it's about 0.6%. So about 1 out of 200 people. But there's a huge range. Obviously, you look at under 20 versus over 80, and it's a huge difference. And in fact, it's exponential. That exponential curve that they were showing us with cases. Well, actually, the same thing happens with fatalities. The fatality rate, it starts off flat, but it rapidly starts to increase as you get to the 60, 70, 80 age group. I think the numbers showed if you're over 80, 1 in 10 chance of dying. If you're 70 to 80, it's about 1 in 25. If you're in your 60s, it's about 1 in 100. And if you're over 50, it's about 1 in 300. So just to give you an idea of how drastically that number changes as you age. And that's why knowing the relative percentage of elderly or at least above 50 or 60 in our positives is going to be instructive to us in terms of what to expect of how burden is our healthcare system going to be, how many people are going to need that extra level of care.
Right. Well, Doc, talking about our healthcare system, as the number of positive cases have increased, so has the hospitalizations. And so we're at double digits now. I think there's 13 hospitalizations. 4, I believe, are in ICU. How alarming is that? And is GMH going to be able to handle more positive cases that require hospitalization? I'm not sure what the bed capacity is.
Well, I'm just sorry to bump in here, Bree, but we're getting Lillian Posadas, the hospital administrator, at around 7:20. So we'll be sure to obviously take all these questions for her. Doc.
Yeah, I think one key data point is that one thing we need to hear from the folks working in the hospital, I think, to get the best assessment of how they're looking and how worried are they, and when will they really start to get worried. I'm sure they're worried now because it's a big change from before. But if you look at the average days of hospitalization, this big meta-analysis I was just referring to, it's about 5 days. And so what that means is with our current volume, about 2 to 3 patients per day should be discharged. And if we maintain 15 incoming patients a day, 2 to 3 patients should be admitted if we maintain the same levels. That's kind of a high turnover. And as long as their current capacity can handle it. So as long as the numbers stay where they are, I'm not super worried about the hospital being overwhelmed. But that's the problem, and that's the question. Is like, we've been slowly increasing. Is it going to stabilize, or is it going to keep going up?
Right.
And I certainly don't think we're in for sort of this exponential phase of growth, because by and large, I'd say 80% of the population are doing mostly the right thing 80% of the time, and that's good enough to keep our numbers relatively stable. What we don't know, actually, it'll be interesting to see the cases this week, because as you guys know, the PCOR initiation, we won't see the benefits of that for at least a week. The people that we're catching that are infected this week were infected well before PCOR was, at least a week prior to when PCOR was initiated. So if the numbers are stabilizing this week all by themselves, it might indicate that this is sort of a plateau that we might be able to maintain. But as everybody knows, we're all at fault, and we're all responsible for even this slow rise. The concept of flatten the curve still very much applies. if we're willing to tolerate this amount of disease in the community, then that this is on us basically. If we want to be a little bit more comfortable to go out and or reopen some of these businesses, we all have to do our part. We all have to not make the bad decisions to take our masks down. It's not easy. I've been at a rosary, which some people are trying to do the right thing, but we get complacent, especially when there's not that much. When our numbers are looking good, everybody gets a little bit complacent. And how to change people's behaviors, that's not in what campaign can you do other than coming in pretty heavy-handed.
Right.
If you come down and say PCOR 1, is the intent to get PCOR 2 behavior? If you say PCOR 2, are you going to get PCOR 3 behavior or no change at all? So I think that, to me, that's the only good thing here about PCOR 1. I think I side with some of the other physicians in the group that had said PCOR 2 is probably okay, but PCOR 1 is certainly safer, and
Right.
we are certainly going to see the effects of that after a week.
And this is this is a kind of like a different PCOR 1 because I'm thinking we have more things that are open.
Yeah, absolutely. It's a different PCOR 1. Definitely there are more things open. There seems to be more cars on the road.
Yeah.
Right. Yeah,
Definitely.
for real. People still want their money. The banks still want their money. The utilities are saying, "Hey, come and pay." So again, it's a little bit of mixed messaging, and I kind of want to go back to what you had said about, if you get PCOR 2, you get PCOR 3 behavior. I mean, it's in our nature. If the speed limit's 35, a lot of us are going to go 45, go 55. So I agree. I think PCOR 1 was just kind of necessary to kind of throw us in that cold water because we just got away from ourselves. It was too many 0, 0, 0, 1, 1, 1, and it was too much of this. Let's open up everything, but hey, guys, take it serious. So it was really conflicting, I think, hard for. And I mean, it is what it is. There's a lot of people out there, especially this 20 to 29 demo, that I think if you look at the numbers, Doc, and maybe we could speak on that.
Is that what you're seeing? It's that particular demographic that has seen a significant increase?
20 to 29 years old.
The younger demographic, absolutely. And from the perspective of, there's definitely an ethical issue where of course we don't want people to die. I feel like 80% of the population are doing mostly the right thing. There's a very vocal 10% who say, well, this is ridiculous. This is totally overblown. These measures are barbaric. I mean, those are the words you're hearing. And they'll come very viciously out against the other 10% who even say we need to lock down even harder. I mean, you'll see those comments too.
Yeah.
Governors doing the right thing. In fact, everybody needs to shelter in place. And so, but people coming out very, very harshly against one another there. The 10% that want to lock down even stricter, they're doing this because they want to save lives. And I don't think you can fault them for that. At the same time, the other 10% are doing this because they really want there to be attention paid to the other costs of closing things up. And I think there is a very valid point in there that we need to think about critically. Who's looking at, in Guam, I don't know, who's looking at depression, suicide, deaths from heart disease that maybe could have been avoided, from delayed diagnosis in cancer? We don't know. And if you don't look at it and look for these things, we don't know. And when you are a little bit too strict or create too much fear in terms of trying to get people to do the right thing and to try to connect with one another, there's costs with keeping kids out of school for sure. But if you're not looking and thinking about those things, I think there's a danger there that it's a blind spot to what we're doing moving forward. So the fact that we have some of a younger demographic getting the disease, there's a school of thought that says at least we're slowly increasing the number of people out there that are immune. And actually, the group that's becoming a little bit more immune are the ones that are going to be engaging in more risky behavior. So over time, if they just keep doing their thing, I'm not advocating it by any means, but if they keep doing their thing, they're also going to be less likely to get it and spread it to their family members as time goes on. That's there's some interesting studies coming out that are looking at that and the herd immunity threshold maybe being lower than we thought, because we are a very diverse mix of a population where not everybody is doing the same, engaging in the same activities. But I think again, in Guam, in an isolated place, and with numbers so low to this point, and perhaps with the vaccine a little bit closer on the horizon, I do think we need to be committed to trying to save lives. And again, I said it was surprising we haven't had a death to this point. I think if you look at our numbers and the infection fatality rate, we should be having a fatality every couple weeks, and that's according to our current numbers, and that's just by statistics, and that's just looking at the average death rate based on the number of cases that you're diagnosing. So if we keep skewing the ones that are getting sick in the lower demographics, that's going to work in our favor.
Doc, what to me is troubling is just talking with some of the doctors on the Physicians Advisory Group, and they are looking at an increase. I mean, they're already anticipating an increase in the hospitalizations, which we've seen. And I don't know if they do that because they make that analysis because they know who's positive and they're maybe tracking some of the pre-existing conditions. But I want to go back to what you had said, that we're almost at that point, right? And if we keep seeing these positives, how soon do you anticipate that we're going to reach that point where we got to start looking at other facilities, things that we were looking at back during the first lockdown?
Yeah, and I it's hard when you don't have all the information, and even if you doubled our current case volume right now, let's say instead of 15 cases per day, we end up averaging 30 cases per day. If the number of people being hospitalized is consistent with what we're seeing now, then just double our hospitalization and ICU numbers, and that gives you an idea right there. Can we handle 25 patients in the hospital and 8 to 10 in the ICU? I think that they would be pretty stressed and pretty strained, and they would be looking at other at secondary facilities perhaps at that point. Now, are we going to double the numbers that we've been seeing over the past week? That's the big question, and there's no way we're going to know if we would have been able to maintain again the numbers we're seeing now, because PCOR 1's been initiated, and we're certain to see a decrease by next week. I'm certain that we will.
What do you think?
Go ahead. No, I was going to ask if you think 2 weeks is good enough, or do you think it should be longer?
I think that's good. I think that hopefully it's a bit of a wake up call for people, and you really hope that the ones that are more responsible for our most recent increases do take some responsibility for. I think they know who they are. I think we know the situations we've been in where we feel a little guilty for how for the way that we maybe weren't as completely compliant. I hope people are looking at this 2 weeks and looking at themselves and saying, what could I have done a little bit better here? It's about protecting our elderly, and I see a lot of elderly patients in my clinic, and we talk about this, and they're scared, and they really don't go out, and so they're doing their best to protect themselves. It's the family. It's really these special scenarios, which I think we've identified some of them, and also it's the household contacts. That's where we're spreading a lot of disease too, and I think the Manumco understand that, and I hope our younger folks understand that too, that even in your home, you at least need to think about it. If I'm infected right now and don't know it, how close should I be getting to my grandma here? Let me just keep a little bit more distance, because I think even a little bit of social distancing in a house probably makes a difference. It's all about viral load in terms of how severe people are going to get infected. So all of these things can matter. And I think it would be nice if some sort of public messaging went out about, hey, think about the things you can do even in your own house, especially if you have a lot of people. How can you not totally throw disarray into the household, but what things can you do to still try to somewhat socially distance from the more at-risk folks that are living in your house?
Doc, when we look at the numbers and we talk about that increase in the 20 to 29 demographic, do you think that we're not seeing that increase in the older demo because, like you had said, Manumco are really taking it serious and maybe staying home a lot more than the younger folks?
Yeah, I absolutely think that's the case. I think folks are not venturing out unless they absolutely have to go to doctor's visits, and I think they probably have their family members running errands for them for the most part. When you really get up into the upper age bracket,
Right.
and I see the children of the grandparents too. They're taking their grandparents or great grandparents to the their doctor's visits, and they're very protective. You can just see how they're looking around, and they want to make sure they're keeping their parents or grandparents safe, and I think that makes a difference too.
Right. No, I agree. My brother takes my mom to her appointments in the States, and he's very meticulous in terms of spraying everything down with alcohol, even her down to her shoes. So what?
I'm
It's just
All right. Hey, over caution is good.
hey,
Yeah.
precious cargo.
You got that right, Bree. Doc, at a closing, man, because I want to go back to when we had you on containing COVID. We were really hitting you up at a stretch where we saw the low numbers and we weren't seeing the hospitalizations. And I remember kind of the tone of what you had been saying there. Just, I guess, in closing, what would your message you'd be? I mean, I know you study the numbers. I feel like you got a lot of insight. So, what's your message out here to the people before we let you go?
Well, I think we're going to be in this cycle in this phase for a while until we get a vaccine reliably, and if that's early next year, I think we'll be lucky. So if we're going to think about the next 4 or 5 months and what kind of life do we want to live here, and if we want things to be a little bit more open, I always kind of maintain that I think we could open up a heck of a lot, and as long as everybody's wearing a mask and physical distancing, we're going to be okay. But we have to find the right balance. We're in the dance phase now. We're trying to dance and say what measures are we able to keep up and still keep our sanity as we approach the next 6 months or so of being constantly at risk of having these surges and potentially stressing our healthcare system a little too much, to potentially having some more fatalities on the island, which of course nobody wants.
Right.
Well, thank you, Doc,
Yeah.
for joining us this morning. Stay safe.
Thanks, you too. Chris,
Right.
wash your hands.
Yeah, I will, and I will definitely wash my. Like Dr. Cabrera said, I'm going to wash my feet because they're the hands of my legs. That was deep. And wash your thumbs. Doc, thank you. Hey, I want to bring you on maybe next week, and we'll talk about if Dr. Lombard was calling the shots, how would you institute a phased reopening after PCOR 1? Because I appreciate your insight, and I'm wondering, like you said, you feel we can open more if we wear the mask. So maybe we'll catch up next week if you got some time and tell us how you would propose to do that.
Awesome. Thanks for having me on.
Some
All right.
homework. Okay, Doc. Appreciate it. Dr. Peter Lombard, 7 a.m. We're KUAM FM in Agotni, Guam. We will take a short break. And we're coming back. We had to move things around a little bit. We've got Sergeant Fernando Estevez from the